Okay, so we have just gotten some new orders from the physician for patient Pat Smith. The first order is for magnesium sulfate, 2 grams IV loading dose stat. And the second order is for magnesium sulfate, 1 gram per hour IV infusion after the loading dose. So I'm going to go to the nurse's station and start preparing what I need to get for the patient. First, I'm going to wash my hands, and I'm going to get out my first medication, which is the magnesium sulfate, 2 grams per 50 ml of ND5W. I'm going to check that this is the right dose, right route, right patient, right amount, and right time. And it looks like we have that. And then I have also just returned from checking the patient's vital signs. His blood pressure was 136/72, heart rate was 83, respiration 16, pain was a 2 out of 10, and his oxygen level is at 97%. So before I go in there, I'm going to get the IV tubing ready, and I'm also going to date, time, and initial of the tubing. Just put this on here. And I'm going to spike the bag. And do that without contaminating. Now remove the cap off of the tubing. Make sure it's clamped. And I would prime the tubing down to the cap. So now that we have done that, I'm also going to check and see that this is compatible with the primary solution infusing right now, which is D5W at 75 mL per hour, and that is compatible. So now I'm going to go to the patient's room to get this set up. Okay, so I'm just outside of the patient's door, and I'm going to wash my hands before I enter the room. Hi, Mr. Smith. My name is Elise, and I'm going to be your nurse today. I'm just here to hang a bag of magnesium sulfate. Before I do anything, I'm going to check your armband. And can I have you tell me your name and your birthday? Okay, thank you. And then I'm just going to check your medical record number. Okay. And I'm going to look to see that I have the right primary IV infusing, and that's D5W, and it is at infusing at 75 mL per hour. Now I'm going to do another check of my medication, and it is magnesium sulfate, 2 grams per 50 mL of D5W. It's the right dose, right route, right patient, right amount, and right time. And I'm also going to just make sure that this tubing is still okay with the date and time. It looks okay. So, I'm going to hang this up here. And before I hook it up, I'm going to clean the clave for at least 15 seconds. So I've done it for 15 seconds, and now I'm going to connect it. So I've got it clamped, and now I'm going to program the pump. So I'll select line B, and I'm going to program it for 100 mL per hour. And the volume to be infused is 50 mL because that's all we have in this bag. Oh, it goes by hours, so we have to set it at 100 mL per hour. Okay, and so now that we have that hanging, before I started, I'm just going to double check one more time, make sure that we have the right dose, right route, right patient, right amount, and right time, and everything looks correct. So I'm going to select start. And Mr. Smith, just so you know that this medication can make you feel a little bit lightheaded or dizzy. So if you do need to get up or you are feeling lightheaded, make sure you use your call light and we'll assist you. And make sure that we have the clamp open on our concurrent line. And I'm gonna, let's see, we've got some air, so we're just going to back prime it. Okay, so I'm going to wash my hands again. Mr. Smith, I'll be back in about 25 minutes because after that we are going to switch the solution bags. If you need anything in the meantime, make sure you use your call light. Okay, so now I am back in the nurse's station. It has been about 25 minutes, so I'm going to get the next IV bag ready. And the next IV solution is the magnesium sulfate, 1 gram per hour, through the IV infusion. So I've washed my hands, I'm going into the Pyxis, and I'm gonna get my bag of solution out, and it is magnesium sulfate, 20 grams per 1,000 mils of D5, mixed with D5W. It's the right dose, right route, for the right patient, it's the right amount, and it's the right time to hang this. So normally before I went in the room I would have a new set of tubing, but for simulation purposes we don't have tubing. So I would have labeled that tubing and primed it before I go into the room. Okay. I'm going to go back to the patient's room and knock knock. Hi Mr. Smith, it's Elise again. I'm just here to change your solution bags, but I'm going to check your name band. Can you tell me your birthday and your first and last name? Okay, I'm just going to check your medical record number. Okay, did that go okay? Okay, good. Alright, so this has finished infusing, so I'm just going to clamp this. And wash my hands again. And for this one, like I said, we would have a different set of tubing, but for this, we don't have them available. So I'm just going to reuse this one and spike the other bag with this one. Okay, so remove the cap, connect it here. Hang this up. Got it clamped. We would fill the drip chamber to at least halfway and have the tubing primed. And then now we are going to clean the clay for at least 15 seconds. That. Just going to connect the two. Okay, before I get it started again, I'm going to just verify that I still have the right medication, right dose, right route, right patient, right amount, right time, and everything looks correct. So I've got the same primary solutions infusing. So I'm going to set this one line B again. And this one is going to be programmed for 50 mils per hour. And volume to be infused, I'm going to put it at 950, so that if it does need to be switched another bag to another bag, or if the physician orders it again, I have time to get that bag, and I'll have it here before it completely runs out. So I will go ahead and open the clamp, and then I'm just going to select start. And once again, Mr. Smith, if you do need anything, if you need to get out of the bed or get to the bathroom, or if you're feeling lightheaded, please let us know. I'm just going to lock the pump before I go. I probably wouldn't tell the patient that, but just for videoing purposes, I'm verbalizing it. So everything looks okay, and I will plan to reassess the patient per protocol. And then also I would probably take another set of vitals since he just had his loading dose, so that we know how he had handled the first infusion. I would also have available to have an EKG done, because sometimes this can cause some changes with the heart.